The WHO says the world is in uncharted territory with the COVID-19 outbreak, as new infections continue around the globe, with the daily increase outside of China way surpassing the number inside. But the WHO also holds out hopes of containment if the correct measures are taken. Now, for a closer look, we're joined by Professor Ben Cowling. He's at the University of Hong Kong, Shing Faculty of Medicine. Professor Cowling, the WHO says we're in uncharted waters. What's your take, and how concerned should we be about sort of the escalating spread of the virus that we're seeing around the world?
I think we've seen sustained spread now in a number of countries, not only in Asia but also in Europe. What we seem to be seeing spread in the United States as well. So I think it won't be long before the WHO begins calling this a pandemic, and maybe this is a change in the way they've been describing the epidemic in the past few days now.
So how should the world navigate the scale of this outbreak then?
I think in China, in Hong Kong, Singapore, we've done pretty well to keep transmission very low. China's managed to end the first wave of infections there, but in other parts of the world we've seen really increasing numbers every day. South Korea's got a particularly large number, but maybe because they're testing a little bit more. I think it's going to be very difficult at this stage to contain the outbreak within China, within Asia. It's going to spread to a lot of the world. We need to think now about the measures that we can take to really slow down spread as much as possible, because we've heard even the last few days about hospitals in Italy having too many patients, and I think the same kind of thing we're going to hear from other countries fairly soon. And that's really one of the biggest risks for this pandemic. It's not just that a lot of people are going to get infected and some of them are going to get sick. It's that there's going to be a disruption to our daily lives. There's going to be disruptions particularly to people with other illnesses, with cancer, with diabetes, and they're going to be having problems getting medical services because hospitals will have too many coronavirus patients.
Well, medical services, the level of medical care around the world varies. It's safe to say that less developed countries that don't have such developed infrastructure, those particular populations will be particularly at risk?
Yeah, I think that's really one of the biggest concerns, is how those less well-developed countries are going to deal with this particular pandemic. You know, how are their health systems going to cope if there are patients that need to be admitted and they don't have space in the hospitals? For Hong Kong, Singapore, we have, quite a bit of space in our hospitals, and we've been preparing for this kind of thing for a while because of SARS in 2003 particularly, but other parts of the world may not be as ready as we are here, and also may not have the capacity as we do here.
But do you think regional blocs might be of help in actually curbing the spread of the COVID-19?
Yeah, I don't know. I think every country is going to have to think about the best ways to control transmission based on what's possible in their country and the kind of effects that they need to have on transmission to preserve their hospital capacity for as long as possible. So I don't know if regional blocs will help a lot. I know that, for example, in Europe, because of the way that the borders are open, it's going to be very difficult to stop spread between countries. But I think that the key is to slow down spread as much as possible, and some countries may be more successful in doing that than others.
Well, you mentioned that the WHO is sort of changing its tone in how it treats the COVID virus. So the US, though, by comparison, is facing a lot of criticism over their lack of preparedness, and some White House officials have even sort of played down the gravity of the outbreak. Is it time for the US to perhaps come to the realization that this is going to be something quite significant?
Yeah, I think for the next few days are going to be critical for the US, as there's going to be more cases identified as they start searching harder, particularly in those areas where we've already seen clusters of cases in the northwest of their country and in some other parts as well. So I guess that's going to be a wake-up call that there has been local transmission going on in the US probably for a month or more, and there's going to be a lot of infections already, and it's going to be difficult to slow down spread, but still possible. There's still time. And the most important time to slow down spread is not in the early stage, it's in the middle. So there's still time to really have an effect on this, first wave of infections in the United States.
All right, many thanks for your thoughts this evening, Professor Ben Cowling from HKU Shing Faculty of Medicine.